Okay. Dr. Almeida is an associate professor and researcher in the Department of Health Promotion in the College of Public Health at the University of Nebraska Medical Center. Prior to his current academic career, he worked for several years in the field of social work, serving family and children from underserved communities. He has over 15 years of experience working in a variety of research settings, serving a diverse population. His research program focuses on highly collaborative approaches to designing, implementing, and disseminating scalable, sustainable solutions to the growing global chronic disease epidemic, with a particular focus on diabetes prevention and treatment, weight management, and cancer prevention. His current work focuses on identifying multi-level strategies to improve the potential impact of weight loss and diabetes prevention interventions, while addressing disparities in access, engagement, and outcomes among health disparate populations across rural Nebraska, excuse me. Currently, he receives funding support from NIH, Nebraska Research Foundation, and Brazilian governmental organizations. Please welcome the co-director of our core, Dr. Fabio Almeida.
Thank you, Kiana. And I'll speak up, and I'm not sure if the folks on the online, if it gets too loud, let me know. I'll turn myself down. And I think we stopped sharing. Is that what we're doing? All right. Okay. And so what we're gonna do right now, we have a two-step. All right. Okay, we're good. Okay. So we have a two-step activity that we're going to do. First, we're going to spend about 30, 25 minutes, give or take. We'll have two members of our community advisory board here with us today that will share some of their experiences working with both from a community standpoint and as well working with researchers and those kinds of things. So then we'll have them kind of talk about some of their experiences, some of the challenges, some of the opportunities that exist for folks that are interested on that. And then after we do it, so it will be a brief panel discussion. We'll encourage folks to ask questions and we'll have a discussion. And then after that, then we're going to have a brief activity where we're calling it as a guided networking activity. Where we're going to get all of you kind of get up a little bit, kind of talk to each other. We'll have a few things just to kind of to get to know and kind of see who else is in the room and what other areas of interest may be here as well. So with that, I'll just kind of give. I'll go ahead and have both Susan and Yesenia both come on. As we say, come on down. We get the Price is Right thing, and we'll get the little music there, and come on down. Here we go. And then, and before we start, so I'll have them introduce themselves. So they'll then we'll have a couple of questions just to kind of get the discussion going. And as Kiana said a little bit about the work that we do, we've been working a lot with rural Nebraska, in particular with the Hispanic population across some of the different areas in Nebraska. And one of the things that we're doing is kind of these community sittings or community meetings types of things, where we're kind of get folks together and then kind of just start the conversation around, what are people thinking, what are people saying, and those types of things. So what we want to what we're gonna do here is we're gonna just gonna have then I'll have Susan, because Susan is the first one here, so I'll have Susan kind of can introduce herself a little bit, kind of talk a little bit about the type of work, the area that you do, and then we'll go from there. Thank you.
Thank you so much, Fabio. Hello, everyone. I'm Susan Mayberger, and I have been in the world of education. So I started in New York City public schools, worked in New York for 15 years, and then moved back home to Omaha and worked for the Omaha Public Schools for 19 years. I was in charge of the ESL Migrant and Refugee Education Program for OPS. And it was at a time when the numbers of refugees and immigrants were growing significantly in our community. In fact, at this time, OPS has about 5% of the student population that are identified as refugees. Our ESL program has over 8,000 students compared to 1,400 when I took over in 1998 in that program. So it is an area that is really growing. While I was at LPS, I also worked I was part of the South Omaha Community Care Council, worked with my colleague Yesenia on that council, and that came out of UNMC's initiative to try to reach out into South Omaha. There was also a North Omaha Community Care Council as well. And then most recently, the last 2 years, I've been the chair of the Omaha Refugee Task Force. Would you please raise your hand if you've even ever heard of the Omaha Refugee Task Force? That makes me so happy that there are some hands raised. So this is a group of about 250 organizations and individuals in our community that meet bi-monthly to talk about how we can successfully resettle and integrate refugees in our community. And just today I was at the Omaha Public Schools and I met 8 newly arrived Afghan women who are starting their lives here in our community with children in our schools, and thinking about all the ways that we can support our new arrivals. I do believe that if we do our resettlement work well, if we can start them on the right path in the beginning, we can avoid having some of the issues that occur down the road when we don't educate both the youth, but also their families in our community. So that is the passion. And then today, just because this is talking about research studies, while I was at OPS today, the social worker there gave me an idea for a research topic, if anyone's interested in picking it up. But she made the comment that she is there was in the family literacy class at the TAC building, it's a class where mothers, or in this case, there were all mothers there, and their young children can come and learn English simultaneously. So while the 1, 2, 3, 4-year-olds that are not old enough for school can be working in the classroom with the parents also learning English, and there's someone kind of with the kid. There's a time when they come together and there's a time where they go apart, but kind of modeling for parents how to work with their young children, because different communities, different cultures, educate in different ways. And so kind of letting them know how, things are in the United States. But the point is that there was a young child in the room that probably is on the spectrum. And the social worker commented that the pediatricians don't necessarily in our community know how to identify youth that might, if it was an English speaking family coming into their offices, presenting like this child was presenting, I think it would be very clear to them. But because this child was from a different background, not speaking, and a family not speaking English, the social worker was commenting that, I don't think that our pediatricians are thinking that autism or children on the spectrum can exist across different cultures, languages, etc. And this child is, not being identified at this time. So it was an interesting comment that connects my world of education with your world as researchers in healthcare. And I also want to introduce Julie Labisi, who is a co-chair, Julie, raise your hand, of the Health Collaborative, which is our committee that does focus on health issues within the Omaha Refugee Task Force. So anyway, kind of a long introduction, but thank you for letting me be here. Appreciate this opportunity.
Thank you for sharing that. That made me think about our first 5 program in Council Bluffs. And you're right, there is, and I'm sorry, I'm gonna back up a little bit, but Yesenia Valenzuela, let's see, my work has been mainly in public health as well as education. And that's how I think Susan and I connected years ago. But a lot of my work has been community outreach. So I'm often a part of discussions like this and invited to sort of share my perspective and how to get you all involved in sort of the different communities within our city. So I predominantly work a lot with our South Omaha community, as well as I've worked some on the north side of the city. But worked for many years at One World Community Health Centers, worked with Family Inc., which was across the river, first 5 initiatives statewide that touched on those exact points, Susan, about how do our providers know how to provide information to those folks that are new to our country, new to our city, and you know, identifying those little ones that may be not developing at the, you know, at the level that they should be, or what are the signs. But the language barrier is a huge a problem in our city. And so part of what I do in my current role at the mayor's office is community relations. So I get to share a lot of what's happening within our city out to the community. So I'm a part of different organizations such as South Omaha Community Care Council and North Council as well. A lot of my passion is making sure that we have information that is in the language that folks feel most comfortable. And so I often am advocating to make sure that things are translated, that there's an interpreter accessible for folks, especially in the medical field. You know, oftentimes we have, or it used to be years ago, I want to say 15 years ago, it was okay for my 10-year-old to translate or interpret for me at a medical doctor appointment. Well, that's not okay anymore. A child is not equipped to translate medical terminology and things like that. So that's something that I was very passionate about. And I continue to make sure that information is in various languages, whether that is, you know, now in my current role in the city, but also I continue to stay involved in different organizations that are advocating for public health and information and access to that information in various languages. So that's a little bit about me. Very excited to be here. Thank you for inviting us today. And I know there's some questions for us, right, Fabio?
Yes, perfect. Thank you, Ethan and Susan. So the first question, just to kind of to start the conversation, and since we're talking about research and how research kind of interacts and intersects with community, and then in particular community engaged research here, from your perspective and from your experiences, if we have a room full of researchers who are interested in starting and initiating a collaboration with a community partner, what are some things from your experience and from your years of experience that are important, that you think would be important for researchers to really think about and to really kind of be aware of once they are thinking about, hey, you know, how do I approach a particular organization or a community partner to talk about research? What are some of the things that you've seen that would be important for researchers to consider?
I think we talked a little bit about this yesterday in our sort of pre-meeting to this event today. And we talked about, we've been a part of some of those folks that come into our community that want to do research on X topic. And, you know, 10, 15 years ago, I think one of the biggest takeaways that we were able to kind of share with folks that were coming in, researchers, was, you know, when you come in and you ask questions and you get to know some of these community members more in depth, bringing back that information. What were some of the discoveries made from that research? Was something that we, you know, didn't see 10, 15 years ago. And I think it's improved along the way. And that's because folks have spoken up about, hey, don't just come into our communities and gather and take information and get to know these folks, but then come back and let us know what were those findings, what were the, you know, what's going to be done in the future to make things better, was one of the things that I remember talking often about. And even in discussions now, we make sure as community members that you know, whatever it is, whatever research you're doing, let us know what was the final outcome of that. Share with us, how can we improve XYZ as a community and not just someone from the outside coming in and digging into, personal information and things like that. So I think that's one of the biggest takeaways along the way that we've made sure we share with researchers and folks that are coming in into the community. So.
To follow up with what Yesenia is saying is to look for win-win situations. You need to do research, but the organizations or the community members also have needs and how can we have a win-win situation? So when Yesenia and I were with South Omaha Community Care Council, UNMC had a research grant that came to our meetings. They actually provided lunch for us on the days that they would come. So when they got so that was a big win for our little group. We had about 60 people there, but lunch was provided, which was a big positive for us. They did like a SWOT analysis with us. So it was also kind of modeling ways of getting input and South Omaha Community Care Council is also a network with a variety of individuals and organizations that attend these bi-monthly meetings. And so, so lunch was provided, techniques were displayed, were shown to us on how maybe we could take back and also do that kind of work within our individual organizations. And it was over a period of time that we worked with these researchers so that it wasn't just like dropping in, kind of getting the input and we never saw them, but it was over a period of time. So that would be one of my suggestions. The other is to just remember how diverse our community has become. The Omaha Public Schools serves over 100 different languages as an example. And that's kind of one of the best ways to even look at diversity. If you go to the OPS webpage under research, you can actually see maps of where different refugee individuals live or different language groups live. So if you were trying to target, where you might want to work, you can kind of, the tool is actually there through the Omaha Public Schools. I know, we live in a greater community, but the bulk of refugees and immigrants or the RIM population does live within the boundaries of the Omaha Public Schools. There are also a lot of newly formed refugee-led organizations, whether it's the Somali community, the Karen, the Karenni, the Bhutanese, the Afghan community has just started with the Nebraska Afghan Community Center just, within the last month. So these organizations, they're really small. They're all well-intentioned. A lot of times 100% volunteer-led organizations. So if your research studies have a way, once again, if there's any way to financially, when you come in, that you can connect with these organizations and provides not even a lot of financial support, but any financial support to bring in the community for these research studies, it would go a long way with those groups. And once again, it enables you to work directly with, if you are interested in doing RIM research with the refugee, immigrant, or migrant population, to really speak directly to them. And that's why I'm gonna, before I leave, I wanna put the Omaha Refugee Task Force webpage up there. We're in the process of updating it, but just so you can get connected to some of, whether it's attending our meetings and getting connected with that, whether it's becoming part of the Health Collaborative. We also have a subcommittee that focuses on mental health issues, because that's an area within the schools that we are always challenged with, is how you address mental health issues, and teachers are being asked to do more and more. And I know we're bringing in social workers to our school districts, et cetera, but some of the issues are beyond even what schools can do very effectively. So, being part of the mental health committee for the Refugee Task Force, we also have education, employment, and housing and advocacy. Those are the different committees that are part of the Omaha Refugee Task Force. But within these kind of groups, whether it's South Omaha Community Care, North Omaha Community Care Council, the Omaha Refugee Task Force, it's looking at these networks that are in our city that you can be connected at a meeting to 60 different people that might be the link that gets you, the population that you'd like to work with for your study.
All right, thank you, Susan and Yesenia. And as we can see, that importance of kind of developing those relationships and really kind of being a part and understanding the community, which they're really thinking through. Now, what I would like to do is, and I want to be cognizant of our time, It's, I want to see if any questions from folks that, anything that you'd like to know from our community partners, and any folks online. I also have any questions that if you want to type in, I can see those over here. Just see before I jump into my question, but if folks that anything that you think that you'd like to know. Go. Oh, looks like
Yes, I have a question just about kind of the process, like how do we approach the community advisory board for feedback or input? Do you guys meet regularly? Is this, do you have like one-off questions, or does it have to be somebody that's currently funded by the group that can receive your advice?
That's a great question. Yeah, though a lot of the meetings that we just talked about, it's open to the public. If you want to check out the website and find out what are the dates, really anyone is welcome to come in. What I would, sort of kind of on that same note of win-win is really getting to know the folks that are running those meetings. Obviously, there are volunteers often, but there's committee groups and things like that. So being part of the entire networking event or meeting, but also getting involved with those subcommittees. But really a lot of those meetings are open to the public, and then there's opportunity at each of those meetings to introduce yourself and maybe talk a little bit about what your intentions are, and hopefully you will come back and build those relationships like we talked about. But that's one of the ways. It's really a lot of these meetings are open, and folks that are bringing new information to the members are, there's always an open door for those folks that are wanting to come in and share information, or also do research and things like that. So they're open most often.
And we've been using Zoom since the COVID started, and actually it's been pretty effective for us with the Omaha Refugee Task Force, where we have at least 60 people at every one of our meetings. And so as the chair of the task force, I set the agenda. And just for example, Kiana, we have on the head of Bridge to Care, that student group is on the agenda for October 5th meeting, because his group, the Bridge to Care, are organizing a refugee health fair for Benson High School. And so he reached out to me and I said, yes, this is, we obviously want to support, health fair in the community. And so come to our task force meeting and, share what the health fair will be about and how different groups that are attending our meeting can support that health fair. And the other part is just getting information out for events, because our listserv is about 250 individuals. So if things are happening in the community, we can get it out to a fairly large group fairly quickly. Our signature event, once again, that Bridge to Care was very involved in, is our World Refugee Day event that was held on June 18th. We had a health fair that was part of the World Refugee Day celebration. One of our best health fairs that we've had in recent histories. But the reason, if you have the opportunity to attend a community event like that, the different refugee-led organizations all had tables and booths at this event. And so you can kind of make the rounds and get connected with the actual leaders of these different refugee communities, or talk to some of the youth. I guess I'm a big believer in the relationship building, and especially in times of COVID, it's still important to go back and to connect with people, let them know and what your interest is, but also finding out what their interests are, what they see, staying healthy in the United States. One of the challenges refugees have is they sometimes, they come to the United States for safety, but in some ways our diet, once they get here and they start eating our diet or our school lunches, and I'm sorry to say our school lunches are not very good. And actually they can sometimes, their kids can become less healthy in a way compared to the traditional environment. And maybe that would be an issue for a family. You talked about diabetes as an example, and that's, something that we should be looking at as a community. Sexually transmitted diseases. one of the refugees told me that they are faced with issues that don't exist in a refugee camp because there's no privacy oftentimes in their refugee camps. They're living in much smaller houses and structures. There's no place for people to have private time together. And he's no access to alcohol, for example, no access to some of the things that can become vices once they get here. And a refugee leader once told me, you know, what's beautiful about the United States is you have choices, but you have choices sometimes to make the wrong decisions. And so things that didn't exist in the camp, like you know, their young ladies getting pregnant, for example, or sexually, those things weren't happening that frequently. And now the community is here in a place of safety, but now are confronted with things that can be very traumatic within the family dynamics. The other part are gang issues. You know, once again, if we don't help the young people and the families when they first come to our country, the young people can, you know, they look at our society and the freedoms that our youth have and those choices that they sometimes make. It's easier maybe to, you know, hang out on the street and they get exposed to, you know, drugs or something. That's an easier path to follow than staying in school and working hard and doing all this homework, which is really challenging for them. And so these are some of the things that I've heard refugee families come to the school district about, you know, wanting help, you know, because they don't necessarily have a repertoire of strategies, because what they would have done in a camp, you know, it's just so foreign to them, you know, parenting. And my last example of that was, I remember the Somali community having a meeting with us in OPS, and they're saying, why is my son or daughter having to stay up all night doing homework on Facebook? Well, guess what? We don't do homework on Facebook, but you know, the youth get the acclimation or acculturation, I should say, is very quick, happens much more quickly with the youth. You know, the children, the kids in school, they'll learn English much more quickly. They're exposed to things that the parents have never experienced before. And then you put them, like Yesenia said, in positions sometimes where they are the interpreters at the bank or in a grocery store, and hopefully not in doctor's offices anymore, but you know, the power structure can sometimes change within the family, and parents really don't know how to do those kind of parenting skills in our country. And so just by talking to families, I think you'll learn a lot. And that's why, as I said, I will put the address for the Omaha Refugee Task Force up there, but encourage you to come to any of the events that we have and get connected through our committees as well.
All right. Thank you, Susan and Yesenia.